It's not preferred, but it has got some pharmacokinetic properties which might be superior to the other drugs. Number one, it's less bound to the proteins, I think, in blood. So free drug concentration would be more. It's excreted in sweat also. So the drug which is reaching to the skin would be slightly higher. Although I prefer itraconazole over fluconazole, but of late I'm also prescribing fluconazole quite a lot. But whether it scores over itraconazole, I'm not sure.
Okay, so I thought I'll just go through the reference. If you see the reference, international reference, fluconazole works like a trichophyton, microspora, vipidermo, all species except the mold. So, and it is useful against the P. verticillata and candida. So, fluconazole, it works for these drugs. And there are, Dr. Micali has shown the slides that the concentration in the stratum corneum is almost 40 times more than the itraconazole and terbinafine. In the nail is also very high. Secondly, if you use a dose daily, then its concentrations remain in the stratum corneum is very high, which is the requirement for the dermatophytosis. In candida, given once in a week and twice in a week, it works because the concentration required is less. Another paper which is shown by Dr. Micali is by Sanjay Singh from Banaras Hindu University, that fluconazole can be used as a 150 milligram daily because he has used it in his trial and is found it works very well. There are other paper that fluconazole concentration again is more in the skin compared to itraconazole. Then treatment of fluconazole in tinea versicolor, the result is 65% better. Itraconazole only 25, and they get relapse. The patient with fluconazole show 5.9% relapse, or itraconazole is 15.3. So if you compare all this is the literature says. There is another paper which is Dr. Micali has already shown. This is from Italy, where they use fluconazole 100 milligram once in a day for 10 consecutive days and 200 milligram fluconazole daily for 2 days for 5 months to prevent the recurrence of pityriasis versicolor, and they could get 93% results if you give prophylaxis fluconazole in pityriasis versicolor. There is another paper from already Dr. Micali has shown that the combination of fluconazole, because it is used in Bangladesh because the low price. So fluconazole is used or is preferred because of low price. So where is the financial constraint, the fluconazole can be used. This is the Western literature, Iowa University, where they say tinea capitis, you can use fluconazole. 6 milligram per kg body weight, and it can be used even daily. It is used thrice or twice in a week, but can be used daily. Same thing with the tinea angwam, also fluconazole can be used. So there is a lot of literature, and this Aditya Gupta, who is very well known for working on dermatophytosis, according to a study, the fluconazole once in a week suggests that once in a fluconazole dose is effective, safe, and associated with the higher compliance with the use in a tinea capitis. And this is the another study by Chandra Grover. He said if you use fluconazole in tinea capitis, the cure rate is 84%. So I want to ask Dr. Micali, because you're seeing a lot of tinea capitis. So what is your view about the fluconazole in tinea capitis? Dr. Micali.
Yes, okay. We are part of a European study in which we are trying to finding the prevalence, an update number of prevalence of tinea capitis in Europe. You know, in Italy, we send all of this data, our data, and I was surprised that compared to the past, we have not seen so many cases of tinea capitis as before. Then I spoke with the principal investigator, and he said to me that in Europe, the trend is that the prevalence of TC is diminished. So we don't see too many cases of tinea capitis. Anyway, Griseo is